All right. So welcome everybody. My name is Jackie Anderson, the director of Raising Wisconsin. And Rachel, you want to introduce yourself?
Yep, and I'm Rachel Peller, the director of Wisconsin Partners.
All right. So I'd like to welcome everybody to our first training called The Power of Parents. What I'll do is share my screen. Whoops, not there. I'll share my screen and we'll go through some of the slides, and then we'll have some opportunities for you guys to actually practice if we want to do that. Um, what it is like to actually tell your story. So what we had planned on talking through today is a little bit more about what is Raising Wisconsin. Rachel and a couple others are going to be talking about stories that Rachel's been hearing as she's been interviewing parents. And then we're also going to be hearing from some stories from you all as parents. And then if we have time, we'll do practice sharing your story. Then we're going to talk about the landscape of childcare and why we're doing all this advocacy. And then we'll go through what I mentioned earlier, how you all can make a difference. So we'll talk about some of those actionable items that we'll be planning out as we move through this process. And then as a reminder, the next training is November 17th. And then we have some homework. If you want to do that, we'll talk that through at the very end. So I'm going to start really, really high level. Oh, whoops, no, I'm not actually. So Rachel, why don't you go ahead and jump in?
Right, so I'll give, I guess, a little bit of an overview of the whole project that we're doing. So our goal is engaging parent voices in a few key areas. So we've put those down on the map. The Northeast, which is super broad, several counties, Sheboygan and Manitowoc, Racine, Southwest, which again is a pretty big area, and then Eau Claire, which were all identified just as key legislative districts where we want to have an impact. And our goal is to find parents in those areas who are struggling with childcare, which is almost every parent. We know that 90% of parents cannot afford childcare right now. If you're using kind of the key metric for what childcare should cost for a family's income, and use those parent stories to connect, like, this is what I am experiencing as a parent, to this is a broader issue and this is what we want to happen. Because something desperately needs to change. We are at like a precipice now for childcare and things are already falling apart. It cannot keep going this way. Parents know this, and we need the rest of the world, rest of the state to like really be in tune with what's going on. So our approach is using one-on-one and small group relationships. So we've hired parent leads in each of the 5 regions who are going to local events, hanging out on Facebook groups, finding other parents, building relationships with them, and then engaging them locally. And then the second piece is this virtual training series that we are doing that kind of goes into the more of the transactional piece of like, what is the childcare landscape? What the heck does childcare have to do with the legislative process? How does that process work? How do we use data to tell our stories? And then really building some confidence and skill in telling those stories effectively and concisely and powerfully to convince people of what needs to change. So go to the next one, Jackie.
Yep, hang on.
So I've been interviewing probably about 60 or 70 parents so far, and most of these have been recorded. And what we're hoping to do is pull out little clips of them, tell like a saga of the parent story. It's one thing for me and Jackie to sit here and say like parents are struggling with childcare, and another thing to actually hear from parents directly. These are just some of the themes that I've sort of anecdotally noticed coming up over and over again. I'm sure all of you are super well aware of these already, but I'll just kind of go through them quickly with some examples. So availability is probably the #1 issue. Even people who can't afford it just can't get in anywhere they want to. People have been on wait lists for years waiting to get places. They've called 50 to 40 centers, licensed family, unlicensed family providers, and still put on wait lists where they're like 200, 300 in line. And this is a pretty serious story. One family was not able to get a spot in any licensed facility. They called centers, they called in-home providers. They ultimately had to place their child in an unregulated home, and the child ended up dying from neglect in that space. So these are some pretty serious repercussions that are coming up as a result of childcare. The second thing that I think I've been hearing the most is affordability. So I'm sure it's no surprise to you that people are referencing costs as a major challenge. A lot of people are taking on overtime shifts. They're drastically reducing expenses. One family has moved into a small apartment with some friends, so they're like really cutting down that way and having to deal with that kind of stress of sharing a space. Economic impact is probably no surprise. People have just left teaching and healthcare jobs in particular, and plenty of other industries that are already experiencing workforce shortages because they can't get childcare where they need it. Other families have mentioned childhood development concerns. So there was one woman who couldn't get her find any place for her child to go. She was a work from home parent, so she had a full-time job, 9 to 5, and she ended up having to put her child in front of a screen every day while she worked from home. And her child now, a couple years later, has pretty significant language and developmental delays, which is a pretty serious. She's really concerned about it. She's a really good parent. She cares a lot about her kid. That's not what she wanted. She didn't feel like she had any other choice. A lot of people have been bringing up mental health concerns, whether it's people who have ended up sort of forced to become stay-at-home parents who are now very, very lonely and isolated, or people who are now working like third shift and just not getting any time to sleep, or they've cut their hours and they're worried about stress. Like whatever it is, people have mentioned all different kinds of like stress, depression, anxiety impacting them as a result of childcare concerns. And there's been a lot of relationship conflict and stress as a product of this too. It's just put a huge strain on families. And there's a major impact on relatives. So grandmas in particular have really been tapped as childcare providers in their 60s and 70s, probably hoping to retire and slow down, but instead, like one woman who was retired drove an hour each way to provide childcare from 9 to 5 Monday through Friday for 5 years because of waitlist issues for her child and grandchild. So these are just a few like kind of snapshots of each of these things coming through. Jackie, can you go to the next one? Okay, these are our parent leads. They're also on video with us. Thanks for joining. Alicia's up on the top left. So she'll be working in the northeast corner of Wisconsin, particularly the Marinette-Crivitz area. Christy is, I don't know how to do this, like second in on my little screen, working in Southwest Wisconsin. I've got a big picture of Sarah over on the right because I'm going to have her do a little featured story in a second. Sarah's in the Sheboygan area. Becca, if I'm going clockwise, is in Racine, and Claire on the far left on the bridge is in Eau Claire. So Sarah, without any further ado, I would love to, if you can jump in. Parent leads, by the way, I'm going to have you also share your stories at some point in this whole series. But Sarah, if you can just kind of do like a brief anecdote of like what your childcare story is and why you wanted to get involved.
Hi, I'm Sarah. I am a new mom. I'm young, and I have a partner, and we just had a baby. He's 10 months old, and we're both farmers. We run and own and operate a cooperative farm here in Plymouth. And so at some point, when I had the new baby, I was like, oh, I would really love to do daycare a couple days a week so that I could work on the farm. And we had saved some money, and I knew that I could try to do at least a little bit this summer. So I called around the area to see if that was possible. And I didn't hear back from probably 75% of the places, just straight didn't call me back. And then I finally ended up getting on a wait list for 2 places. One of them was 45 minutes away and the other was 25 minutes away. And both of them I was waitlisted for at least 8 months. And so that was something that I just didn't expect at all. We don't have grandparents anywhere nearby. We don't have any support really. So we just had to kind of figure it out. I wasn't able to work at all. My partner had to run the farm alone. And on top of it all, you know, we were trying to become new parents. So it was more of a struggle than I could have ever imagined. And when Rachel came to visit, Rachel and I know each other through cooperative connections. And she came to visit and asked me my story and asked me if I felt like doing any advocacy and getting involved. And since I had done some advocacy in my past in Milwaukee, and particularly with the Montessori community, I helped advocate for getting the Montessori licensing to be well represented in the state as a education license. And so I just decided that this was something that I was interested in doing, and now I'm the parent lead of Sheboygan.
Thanks, Sarah. Jackie, if you don't mind pulling the list of themes up, what we want to do is send you all into breakout rooms for a little bit, so you'll be paired up with somebody else. And then we're hoping that you can share the piece of your story that connects to one of the themes, if not more. So I think what we're trying to do is like start building some practice in going from, like, I've already heard most of your stories on a one-on-one basis so far, but it was pretty open-ended. And so what we want to try to do is connect like your personal story with something bigger that's happening. So you're just going to go out into a one-on-one and practice that with somebody else. Jackie's going to pull up the list of themes so that you have it in front of you. But basically it's,
Whoops, hang on.
Availability, affordability, economic impact, childhood development, mental health, and impact on relatives. And I would also be curious to hear at another time too, if you think there's anything like missing from this that you are hearing in your own communities. But does that make sense for everybody?
Can someone paste those in the chat?
Yeah, that's a great idea. I can do that. I'm actually going to stop sharing, and then I'm going to put you guys into.
Type those out and put them in the chat.
Whoops.
I'll start typing that up now. So basically you're going to share your story one-on-one with somebody else and connect, like, how does your personal story connect to one of these broader themes?
So here are the broader themes.
Oh, perfect. Thanks, Jackie.
Yeah. And I am going to put you guys in
4 rooms, I think.
Yeah.
Okay. I want to do a quick debrief. So I'm curious how that felt for each of you, especially those of you who have shared their story like openly with me. Did it feel harder to go from having this like big 25-minute phone call where you could talk about anything to trying to narrow it down into like a 2-minute story where you're connecting that to a theme? What felt comfortable? What felt tricky? How did that go for everybody? Maybe I'll just, if I can hear from 2 people, and then we'll shift gears.
Here, I can get us started. So my name's Becca. I'm in Racine. I thought that it was tricky to condense a 25-minute story into 2 minutes, number one, but also pull out the highlighted parts and also share it with another person that I had never met before. So I wanted to be able to say what I thought was important, but not bore the other person. So it was kind of hard to come up with words on the fly, but it turns out I think we did a good job.
That's a great
And
summary, Becca.
I'm going to completely agree with that because it is kind of such a complex, so many factors that work into it. I mean, out of the 6 themes, I think 4 of them, you know, could potentially fit in my story. So definitely agree with condensing, making sure to hit the highlights without, you know, I'm pretty sure I talked a little bit too long, but Trying to get, just get the point across and make it something that is inspiring and that motivates people to want to join and help in these efforts.
Well, thank you all for trying that. Yeah, and Becca and Alicia for sharing out. I think that's a very normal experience and response from having all this spaciousness to suddenly cutting it down, and we didn't give you any time to prep for it. But that's part of what we'll be doing over the next few months is practicing, figuring out what is the sharpest part of your story, the most compelling part of your story, and how do you, I think a lot of people know to have a story that's really compelling, you have to kind of touch into your senses. You want to make it a good, clear visual for somebody to empathize with. So how the heck do you do that in such a short amount of time? So that's part of what we will be working on over the next few months. So I'm going to pass it off to Jackie, I think, from here on out.
Yeah. And I think too, we're not used to, it's not like we want people to feel bad about our stories, but that is what's going to evoke emotions. We want to be able to say, I couldn't go to work, or I put my child in an unlicensed program, and this is what happened, because that's where those stories and that impact is actually where it's going to make a difference. So what I'm going to talk about now is really high level, and in terms of what our advocacy efforts look like. We'll get into some real tangibles around what we anticipate some of those actionable items are that Sarah talked about a little bit earlier. But I do just want to also offer us all grace, because we've never done this before. We've never done parent advocacy before. WECA, which is Wisconsin Early Childhood Association, has never done parent advocacy. So this is something that's really new to us. So, and I think I explained that to a lot of you already, but there are going to be some times where we're ooh, shoot, we totally missed the mark on that one. Let's repivot and figure out a different way to approach this. So I think that's exciting, but also a little scary at the same time. So I think I just so appreciate you guys all being on this journey with us to really be able to make a difference in really our state, because we're in some desperate times right now. So I'm going to talk really, really briefly. Again, I'm going to go pretty quickly. And then we'll have, for those of you who are parent leads, we'll have a debrief next week too. So if there's something that you want to talk a little bit more about, we certainly can do that. So this is the vision of Raising Wisconsin. So Raising Wisconsin received a grant 3 years ago to really focus in on infants and toddlers in the state of Wisconsin. So we had these big audacious goals, and we had lots and lots of deliverables. We've since narrowed it down to this vision statement and really focusing on 3 main goals. One is access and affordability for our Wisconsin families. The second one is to support our ECE providers. So ECE is early childhood education. So those are the staff who are taking care of your kids when you are in a program. And then the third one is focused on optimal health and well-being. So outside of childcare, we also are advocating on behalf of, and I'll just say these really high because we'll focus today just on childcare, but we're also advocating for mental health support. So that includes training and supports for families and ECE staff. We're also advocating on behalf of home visiting. So Family Foundation's home visiting program, which is where home visitors actually go into families' homes and connect them with resources and support. And the third one is Medicaid extension for 12 months postpartum for all birthing people who need that additional support. Right now, currently, babies receive Medicaid coverage for 12 months. Moms only receive it for 3 months. So we're really advocating to have that be aligned because it just, for the love of God, makes a lot of sense. So we won't be talking about the health and well-being piece. If you are ever interested in advocating on behalf of that stuff, I can certainly hook you up with that. But for this conversation, we're really going to focus in on childcare. So these are our different coalition tiers. So we've got the first one on the left, which is the state collab team. It's 50 different organizations who all have signed on 2 years ago to say, I'm going to advocate on behalf of childcare. So think in terms of organizations like Council of the Churches, United Way, the YMCAs, towns and municipalities, the Counties Association, UMOs, so focused on immigration. So it's really organizations that might have their hand in childcare, but most often they're a support system for families who are in the state of Wisconsin. So we've got the state CLAB team, we've got employers and economic development leaders. So we're having right now meetings, legislative forums with business leaders all throughout the state. Last week, we were in Beaver Dam and we met with Representative Bourne as well as Senator Jagler. And we had about 40 different businesses there who were all saying, my staff can't come to work because they don't have childcare. So that's the second tier. The third tier is where you all fit in, and that's the parent advocates. And then the last one is early childhood providers. So last budget season, we heard really loud and clear that legislators weren't hearing from parents and they weren't hearing from businesses. And I've shared some of this with you, but I have 3 kids myself. And when we couldn't find childcare, the last person I called was Mark Pocan. Like, our society is just not set up where we call our legislators when you can't find childcare. So, we're trying to explain that to legislators and they're getting it, but hearing your stories and your voice is what's really, really important. So we've received some outside funding to hone in on these counties, and we're really being targeted on these counties because they have representatives who are incredibly influential and are incredibly conservative. Not that that's bad, but that will make a decision in how childcare funding gets allocated. So that's why it's really important that's why we've picked those areas so that Lemahue, for example, can hear from you guys. Some of these will actually change as of in a couple weeks, probably. It's these representatives who need to hear your story. So that's why we're being really, really strategic on these specific areas. So when we're talking about childcare, here's some of the data. So you can see here the potential need. This is for the state of Wisconsin. There's about almost 300,000 kids who need childcare, and there's only about 171,000 slots available, which is a gap of about 117,000. So if you look at our gap, which is 40% of that potential need and supply, and you compare that nationally, Wisconsin is one of the worst states in all of the US facing this childcare crisis. The economic impact is 2.5 to 3.8 billion, which means that many parents are not able to go to work and not able to produce in a way that our businesses would hope that they could. So the next piece, though, I really want to talk this piece to, because I know so many of you are in what's considered a rural community. More than 70% of our programming our Wisconsin state is considered a childcare desert. So that means there's one licensed childcare slot for 3 or more children under the age of 5. And what you guys are experiencing and your stories is what this is. A lot of you who are in rural communities, there's just an absolute shortage. And what's happening with family childcare providers, they are closing their doors left and right. A few years ago, we had about 7,500 programs in the state. Now we're down to about 2,000. So that has just been, during the pandemic, like these programs have just not been able to stay afloat. So you guys, I'm like totally preaching to the choir here, but part of the reason why is because this annual cost of childcare is higher than a UW tuition. So, we've got these high costs, we've got infant care. If you've got a family with one child, the income, the care would be taking about 18 to 25% of the family's income. If you add more kids onto that, it's even worse. And then if you have a single full-time minimum wage worker, you would need to contribute 83% of their annual income just to pay for childcare for an infant. So you've got lack of childcare slots, you've got the high cost of care, and then you've got this overall crazy situation that we're in right now. What's interesting is that, when we're hearing from these businesses, they're saying they can't get folks to come to work. If you narrow that down to moms, pre-pandemic, we had about 68, this number is slightly old. It was about 68% of Wisconsin infants had mothers in the workforce compared to what's now about 62%. So that means that many more moms in the state of Wisconsin were are in need of work. So there are that many more moms who are going to work, which means there's that many more moms currently now who are not able to work because of a lack of childcare. So, so those stats, we've got loads of stuff like that on our Raising Wisconsin website. So, you know, we will, once we get closer to our actual advocacy actions, we'll arm you, like we'll tell you where all those resources are, so that if you want to like bring any of our collateral, you can certainly do that. We'll also have our next webinar, which will focus on the data. So using the data in your district, for example, you can say like, this is how many slots are available. This is how many children need it in my district. We also can pull childcare counts funding, which means that's the federal funding that we're advocating on behalf of. We can pull that for your district, so that if you're meeting with legislators, you'll be able to say, this is actually how much money that we received in the past, our childcare providers. This is how much money we're not going to receive. They're not going to receive if we don't actually get this new funding. So this is, again, really high level, but I wanted to show you guys the timeline of the budget season. So right now, agencies are all submitting their request for budgets, and the governor will announce his budget, regardless of who it is, in January. And this purple part there, where it says legislators are in session, that's where hard advocacy happens. So that's when we're going to be doing things like making multiple phone calls, sending emails, doing public forums, or anything where we're getting your voices and your stories out. That is the most important time, is like January to February. We can certainly do it now. Now, though, would not be the smartest move, knowing that election day is coming up and things are going to change probably pretty drastically. So we'll have to repivot once we find out kind of where everything lies. But I wanted to give you like the timeline of what this actually looks like advocacy wise. So some of those things, this is like, Sarah, to get to your point, like these are some of the things that we're thinking right now. So, we've had a lot of success with some other advocacy that we've done, where on one given day, at one given time, everybody sends a text to their legislator, or, everybody gets together at somebody's house or a library or wherever, and everybody gets on their phone and makes those phone calls. So those are things that we'll hear from you all as parent leads to figure out, what is it that you want to do? We'll provide recommendations on what we would recommend we'll do. We'll also bring our lobbyist in to really be able to hone in on, like, they're so savvy in knowing, like, you should really go to this public forum because, this legislator is going to be there and this is his or her issue. So we'll be strategic too, and we'll let you know when those public forums are, because those are really important. And then we also will have a WECA Advocacy Day. That is the first week in April. So that's another opportunity where we at WECA will organize legislative visits. And then if you are able to come to Madison, you could do that and you'll join in on our advocacy days as well. So lots of really exciting opportunities for us to do some really good work. So that being said, I did want to let y'all know that November 17th, this is our next webinar that's focused on using data to tell your story. We also, while you guys were in your breakout rooms, we realized that was a Packer game. So that may be a date that we actually switch, because we want to ensure that we have some really good participation. So we may end up switching that one up a bit, because we want folks to be present. And then December 15th is how decisions get made in the state budget. So for this one, we will have a lobbyist either from WECA or a lobbyist from another organization come in and really like give you the background on how decisions will be made, and the election will be at that time. So they'll be able to kind of fill us in on some very specifics. So I wanted just to correct you, and I think many of you have already visited our Raising Wisconsin website. But if not, I will put it in the chat box. What's really, really important is that there is a take action page. So if you hover over that, there's actually very specific parent toolkits that will give you email templates, for example. It'll give you like talking points. It'll give you some of that data that I talked about. So, even if you're interested in advocacy and you don't go to any other training or any other parent activity, go to that page, because it will give you an opportunity to really be able to see some very specific data to share with legislators. We also, under our policy agenda and progress, we just added a brand new tab that's called budget ask, state budget ask, and that's where our state budget ask will be. So anything, you know, we're advocating on behalf of childcare counts. So our ask right now is 300 million. I say right now because that could certainly change. But our ask right now is 300 million, and under that budget ask template is a white paper that gives loads of data as to why we are advocating on behalf of childcare counts. So we can talk about that even more on our next call as well. So with that, I'm going to stop sharing. And yes, lots of good questions here. Yeah, thanks, Ken. There are some tough people to sell. Yeah, there's some tough cookies on some of that list. So I'm going to try to answer some of these questions. The data reflective of the pandemic losses in childcare providers, or is it pre-pandemic? It's a little bit of both, Christy. Where is Christy Cole? There you are. It's a little bit of both. The number of mothers, that was pre-pandemic compared to now. So the numbers of losses, like that economic loss, is as a result of the pandemic. Does that make sense? Okay. And then, do I have the cost for children who are 2.5 and older? So that is, that's hard to say because it depends on whether it's a sender-based program, whether it is a family childcare program. You know, what I can show you is something that we reference that's called the true cost of care. So what's cool about this, and I'll actually share my screen real quick, is if you look at advocacy resources, you can see this cool thing that is called the a broken business model. So you can see cost of care and what this actually looks like. It doesn't actually break it down by age group. The younger the kids are, the more expensive the program is. I mean, that's because of the ratio and ability to ensure safety. Because infants and the younger kids do take a lot more hands-on support. So can't give you a number because there's so many different variables. It depends on how many stars the program is. It depends on if they're licensed or not licensed. So there's lots and lots of variables there. So I wanted to give the parent leads an opportunity. If there's any events you want to talk about are coming up, you certainly could share those here. Or if there's other questions that you guys want to talk through. And Annie, I want to welcome you too. Hi there.
Hello, everybody. I'm sewing a Halloween costume for tomorrow while I listen.
We're glad you're here.
Thanks. Nice to see you guys.
Yeah.
Jackie,
All
can
right.
I just clarify one thing? Because I have had some people ask me, like, what is that ask? So you said it was going to be 300 million, and then under that take action, there's a white paper that will list out what the money will go towards.
Oh, let me actually show it to you.
Okay.
So if you go to our Raising Wisconsin website and you go under, sorry, I need to move all this stuff around. Under policy and progress, you can see the state budget request. So if you click on that, whoops. So here's our budget asks, and then the why it's important. So this is like all data that talks about like what the fiscal clip is, which means that childcare providers have received what's called childcare counts. In January of 2024, that money will no longer be available. So that means all of the extra staff salary increases that were received, whether parents were given reimbursements because they had to pay during COVID when their kids weren't in programs. It's money like that that will no longer be available. So how programs have kept their doors open and kept high quality programming, that will no longer happen. So Claire, to your point, here is the white paper on the thought and the numbers behind the 300 million state investment. Okay. And then did also want to show you the take action page. So if you click on families, this is something that you can direct folks to. There's advocacy tools and resources, and then you can click on families. Oops. And then there's lots in here. Some stats, some messaging, phone call recommendations, email templates, and so on and so forth. And I'm going through it super fast, just to give you an idea where everything is. All right, other questions? Any parent leads want to, oh, go ahead, Sarah. It looks like you have one.
Yeah, I was just wondering if you could try to maybe link the white page to the chat because I'm having trouble finding.
Yeah, for sure. And then again, our focus is on childcare, but we are also doing white papers for our health and well-being desk as well, if you happen to be interested in that. Okay, so that was a lot. I talk really fast. So anyone have any other questions? Or anyone else want to?
This is Christy. I'm in Southwest Wisconsin. We have our first in-person gathering coming up on Sunday. We are going to meet at a local winery it's a great place for meetups. They have an indoor space as well as a beautiful patio and a garden space where kids can kind of run around. So I know most of you are not nearby. Christy Johnston, you are. I bet you'll be there. But if you happen to know people in this area, like share that with them. And I would appreciate you sharing the information, and hopefully we get a good turnout. We are in, it's in Mineral Point is where the first gathering will be. We're focusing on like Mineral Point, Dodgeville, Platteville, Spring Green area.
And you have Markeline over in that area, so
we've got him. That's true.
He's one of the tough sells.
He is a tough sell. Those cowboy boots are hard to get through.
Yeah.
This is kind of related to that. This is something that came up in one of my conversations with a mom, and it might be more of a parent lead conversation, but just maybe some ideas and thoughts about kind of framing the advocacy. The mom that I talked to flat out said, as soon as she hears that we are trying to reach out to elected officials or politicians, she's out because there's no point. So if there's maybe any, and I don't think she's completely wrong, and I not necessarily that she's wrong, but I think that that is a very common perception. So that's kind of part of the issue that I've been running into. So just maybe if anybody has any more ideas on, I've been really stressing on the nonprofit side and the organizations that we're getting together, and that's exactly why we're doing what we're doing, trying to get those voices and making sure that we're pushing to get that heard. But just if anybody else had any other thoughts and ideas on, kind of just framing that advocacy piece, kind of to push past that perspective.
I guess to me, it's like, it can be as simple as sending a template email, right? You don't even have to do anything. We can spoon feed you the information and you press send. And even if it doesn't do any good, it took you a minute to copy, paste, and send. So I don't know, maybe just talking about how easy it is and saying, you're right, it might not work, but if you never try anything, you're not going to know if it will, I guess. That's kind of how I see it.
Yeah, that's a good point.
And Alicia, I think also that our stories can really reverberate in unexpected ways. Like, you don't know who's gonna hear your story. Like, we live in an area where our 2 elected state representatives are both in the tough sell category. And they are also both firmly entrenched because of the way the district is written. Like, there's very little chance we are going to be getting different representatives. But I also think that if you think of them as kind of like the target for your story, but like maybe collaterally, there will be other people who will hear it, and your story can kind of compound in that way. I think that that's important too.
And I see
agree.
that you have your hand up too.
Yeah, sorry, I know I just came in here, but I've done a lot of hard conversations, not on childcare, but on healthcare. In my experience, and I'm not trying to talk down anyone because you're all very passionate and awesome in this work, but like in my experience, just listening to people as a first step has been something that's been really powerful when I've been able to emphasize, I want to hear your story, wherever you're coming from, digging deep into what their experience is before moving on to messaging and advocacy, or trying to get them to take action. I've found that to be really transformative for people, including people who initially, where they were signaling that they had really mixed emotions about that topic. So I'm really excited to see what you all do with this, and maybe I'll get involved here and there because it's a really important issue.
Thanks.
And I just want to bring up too Sarah's story. I mean, Sarah started out and, she explained that as a parent, and you happened to be working in a Montessori program, if I remember right, and you advocated, and you probably had that thought of like, I don't know if this is actually going to make a difference. Like, I'm just going to try and I'm going to tell my story. And the result is that you were able to get, Montessori at a different level when it comes to licensing. So, I think it's one of those things where like, it can't hurt. Like someone else said, like it can't hurt. And all you have to do is be an expert. Like the word advocacy is so scary to a lot of people, but all you're doing is telling your story. And this is one way that has never happened before in the state of Wisconsin, and like a collaborative way like this to really be able to tell the story. So it does, I believe that it will actually make a difference. So it's just like Claire said, like just maybe one email might make a difference. Like it's a simple step. Rachel, were you going to say something?
And I agree.
Oh, go ahead.
I was just going to say, I absolutely think it will make a difference. I'm just still a little, haven't done a lot of this before in advocacy. So trying to frame it to, get people just as excited and just as, involved as I want to be is, I'm still working on some of those skills. So
we all are. I am. So
I probably have too many things to say, and it's 8:57, so I'm going to try to be concise. Just echoing what Chrissy said earlier, some of it is like peripheral. I actually don't do as much advocacy personally. I'm more in like a community engagement, cross-sector collaboration space. And we started doing this project by going out and asking like a local pastor, a local healthcare provider, a local nonprofit, we're going to do this childcare project. They said, great, childcare is an issue here. And I said, cool, can you connect me to any parents? And most of them said, well, I don't actually know any parents who are struggling. And I just was blown away by that, as I'm not a parent either. But if somebody asked me, do I know any parents in my community who are struggling? I could give you like dozens of names of people who could not afford it, can't find it, are tired of cancellation, people have this like very, I think like tiny idea of what it means to struggle. Mm-hmm. And I think we need to open that up and make it part of like a community conversation. And there might be people who don't want to make legislative asks, but I think if they are going out and talking to their pastor about their childcare struggle, they're talking to their boss about their childcare struggles, they're talking to their aunts, uncles, cousins, whoever, we can build some shared momentum one way or another, depending on how people are engaged and interested. I also think there has been investment in childcare. There was already the 800 million through federal funding. So it's not like it's unprecedented for there to be support and investment in childcare. We just need to, and we've seen the positive impacts of that so far. We just need to keep that going so that we don't have a cliff.
Right.
And I also, like, frankly, we are just at such a breaking point. Like, something has to happen. It cannot keep getting worse than this.
Because parents can't pay anymore and programs can't lower their cost anymore because it's so expensive to run a program. So we're at that breaking point for sure.
Yeah. So I think whoever, if you just want to move away from like you're advocating to legislators and frame it as in like your voice makes a difference. And if you want to use your voice to talk to your own family members, your own friends, your colleagues, your whoever, that's powerful too. I mean, we would love for them to like really share their voice in a way that's going to like make the biggest impact. But I think the more people we have talking, just the better we are.
For sure. Thanks, Rachel.
Can I ask one question too? Do you guys know if this sort of advocacy is happening anywhere else in the country, and if there are any other like models that you guys are working after?
Yeah, there's actually one in Chicago that Rachel and I are meeting with in a couple weeks, where it was parent advocacy on behalf of Chicago public school systems. So, you know, slightly different age group, but parent advocacy and the momentum that they have gained in the city. And I believe also they did some surrounding areas too. So we'll be learning from them a little bit more. And then there are some other cities too who have some pretty strong infrastructure. There's organizations like Moms Rising, Strolling Thunder is another organization who we've also partnered with to figure out ways to really keep doing this. So Sarah, there is yes to your question. There are other states as well.
There's also a ton of parent groups in Wisconsin, I mean, and all over the place who are doing parent engagement and parent voices. It's just that a lot of them tend to be like of school age kids, like elementary plus. And so there's, I mean, you had talked about this too through Montessori work. There's tons of models for engaging parents in the work. It tends to be harder, I think, to engage parents of childcare aged kids, because there isn't as much of like an organizing, there's not a PTA for
Right.
childcare parents.
Right. Yeah, it's thousands of different programs. So it's not like one unified thing. It's some are family childcare providers, some are licensed, some are, you know, unlicensed, some are centers. Like everything is slightly different. So rallying the troops is going to be slightly different too. So
I have a quick question. Are you getting family resource centers and CCR&Rs involved?
yeah, so we just talked to Family Resource Center last week up in Beaver Dam about this. So we are over in Beaver Dam. So the answer is yes, we need to do a little bit more. Christy, do you want to share what you're thinking, or just as a way to get engaged? Is that what you're recommending?
No, I'm just thinking like, you know, as far as like a local place where parents go to.
Yep.
And so the child care resource and referral, they know how many parents are calling. You know, they're the ones who are trying to help parents find childcare.
Yeah.
And so I was just wondering if that was some of the organizations that you've reached out to get more parents, you know, active, or just people who are trying to help.
Yeah, it's a great idea. Yeah, we could definitely use some help with that and reaching out to them. Great. All right, I do want to be cognizant of time, and I also know that all my 3 kids have taken full advantage of me being on this call and nobody's in bed. So I want to thank you guys so much for taking the time. And if you all are parent leads, we'll see you next week.
Jackie,
Thanks,
we wanted
everybody.
to send them off with homework.
Oh yeah, you want to talk it through?
Yeah, it's not scary. It's an easy ask, but we wanted to make sure that there was like something to do in between this session and then the session that is maybe getting rescheduled, but probably in about 3 weeks from now. So your assignment is just to tell your story to somebody that you haven't told it to. So you could call up just a friend or a family member and say like, hey, I'm getting involved in this parent advocacy effort, and it's because blah, 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 like, because this is what I experienced myself. If you want to do it with your local team of other parents and do it like as a way to connect with other people there, that is great. If you want to talk to your colleagues at work or whoever, just kind of like start practicing. You had the chance to like talk with me and have this like nice long 20-ish minute conversation, and then we had a small chat here with other people who are already invested in it. So I just want to like keep building up that practice around kind of scarier and scarier storytelling. So that's your assignment. We'll check in next month
Awesome.
as accountability. So
That's great.
tell anybody.
Thanks, everybody. Have a good night. Thanks, Rachel. Thanks, Maddie. Take care.